Hello, everyone. This is Patrick from ApplyChat Healthcare. Welcome to our latest ApplyChat Healthcare podcast as part of our regular webinar series on nurse and healthcare recruitment topics and healthcare human resource matters generally. To watch our webinar videos and view the presentation notes, you can find the link to our YouTube page in the podcast notes. You can also find all of our free resources and learn how ApplyChat Healthcare finds more qualified nurse applicants for our healthcare clients by visiting us at applychathealthcare.com.
Hi, everyone. Hi, Rachel. Hi, Ryan. Welcome, everyone, to today's ApplyChat webinar. Today, we're going to talk about taking a holistic view in supporting women in healthcare. And my name is Patrick Peely. I'm the Chief Operating Officer at ApplyChat Healthcare. And we host webinars about twice a month, typically on topics related to nurse recruitment and healthcare recruitment, human resources topics generally. And as people are joining, I just want to share a quick overview of what we do at ApplyChat Healthcare. Our goal is to help healthcare clients to reduce agency fees and boost nurse headcount with our three-step solution, which includes sourcing passive nurse candidates from outside of the job boards, screening every candidate to ensure they're qualified, and following up with every candidate to keep them engaged and excited about the new opportunity. And in our last webinar, we focused on our learnings from 2022 when we helped our clients make 251 permanent nurse hires in 24 US states and Canadian provinces. We're really proud of those results. And as an example, we've helped Thrive Skilled Pediatric Care to hire 84 permanent RN and LPN home care nurses across their 40 locations. So I invite everyone to visit my online business card. I'm going to post that in the chat right away. And find out more about how we do this work, and you can access all of our free resources there, including our past webinars and sign up for future events. You can sign up for our regular newsletter. We just launched one this morning. You can join our Nurse Recruitment Secrets Facebook group, and you can sign up for our new Healthcare Recruitment Leaders Exchange networking group as well. So on that note, I'd like to introduce today's guests. Rachel Oldham is a clinician network manager with Direct Shifts, and she's joining us from Chicago. Welcome, Rachel.
Thank you so much.
And Ryan Engelhart is a director of recruitment with Direct Shifts. And if you see on the screen her title, it's recently changed. And congratulations on that.
Thank
Ryan.
you. Thank you very much.
And I'm going to just put back the link so you can find us on in my online business card. And I'm going to turn it over right now to Rachel to talk a little bit about Direct Shifts. If you could tell us what Direct Shifts is all about for our audience.
Yeah, thank you so much. So really what we are at Direct Shifts is we're a tech-driven solution in an open marketplace for both clinicians and healthcare organizations. So what we do is we allow clinicians of all kinds, different backgrounds, different stages of careers, to upload all of their documentation, their professional references, manage it all in one place. We also allow them to input a lot of their preferences, and we utilize all of that to use technology to match them directly with open shifts and positions that we have at healthcare organizations and systems across the US. And so what this does is it creates an on-demand workforce for hospitals, right? They're fully credentialed, ready to go. They're in their location. It provides a lot of flexibility and cost-saving solutions for organizations to be able to fill those open positions very quickly. But really what the focus is being very clinician forward. And what we mean by that is really empowering the clinician to work in the way that they want to with their own preferences, their hourly rate, the types of shifts that they want, the hours they want to work, you name it. It's really putting that power back into the clinician's hands to really know, okay, these are the jobs that are available to me. I can and cannot take it. And it's purely up to them. And so we offer this open marketplace that's very tech forward to be able to appease both sides and really keep healthcare staffing going as much as possible.
Well, that's great. Thanks for that overview. That's really interesting. And I know when we met, Rachel, we first met in October, I guess it was, in Austin at a healthcare conference, and I found your product and really interesting when I met your team, and we've been connecting ever since. And this webinar is one of those things that came out of that. So that's great. Thanks for that overview, and people can find you on LinkedIn to find out more about that.
Yeah.
Thanks so much. Okay, great. So let's get on to today's topic, which was inspired by International Women's Day coming up next week. Every woman has many roles in life, both personal and professional roles. Each of these roles impact the others, and every individual has different needs depending on those roles. And we know that supporting women in healthcare improves job satisfaction, it increases employee retention, and ultimately improves patient outcomes. So workplaces need to take a comprehensive view to supporting women in order to meet their needs, depending on the specific roles they play at work and in life. So today we want to talk about some of the challenges women face when working in healthcare, some simple actions that each of us can take daily to support our women coworkers and employees, and things that employers can do to support women by implementing structural and policy changes as well. So Rachel and Ryan, let's just start off with why you wanted to have this conversation today.
Yeah, I'll go ahead and jump in. So I think this is such an important and timely conversation. And every time as International Women's Month gains popularity year over year, and we're having more in-depth conversations. 5 years ago, we might have been talking about pay differentials, right? And really introducing the idea that women and women of color maybe are not at the same point in time, right? But those conversations have advanced so much. And even the last few years, the more that we talk about it. And something that we find is really important is talking about what does that look like in the healthcare system. And for us, because of what Ryan's doing on the recruiting side, what I'm doing on the organizational structural side, we're in such a unique position to actually really enact some of these big changes that can make an impact with the female clinicians that we have. So having this conversation, it's both timely and relevant, and we may have additional insight that we can offer to other organizations that may not have looked at it from our perspective, but can learn from what our experiences are.
Oh, that's great. Well, thanks thanks both of you for joining again today, and Rachel in particular. When we were speaking and we were talking about the idea of hosting a webinar, this was really your idea. So thanks so much for bringing that up today.
You're welcome, of course.
So we'll get into our three topic areas, and I just want to remind the audience, if you have any comments, questions, please post them in the comment section in the chat, and we will watch those and try and get to those as best we can during or at the end of the webinar as well. So Rachel, Ryan, let's talk about, initially set the stage. What are some challenges that women face? Challenges, women in general, but in particular women working in healthcare.
Yeah, so when we think about healthcare, we have to think about what healthcare has experienced in the last few years. There is no way we can even talk about healthcare without recognizing the fact that it will never be the same post-COVID. It won't. We are seeing burnout levels that are extraordinarily high. We are going to continue to face staffing shortages. And the reality is these were all problems that a lot of people were aware of and knew were coming down the pipeline.
Right.
These are fires that we knew were going to hit. But the reality is the pandemic has exponentially sped up that time frame. And so we have clinicians that are doing early retirement, that are burnt out. They are leaving the field. They're not interested in taking any more healthcare jobs. An example of that is I've spoken to 6 different clinicians in the last 2 weeks that have shifted out of clinical work and into consulting.
Wow.
Right?
That's a big loss for the industry.
It's a huge loss for the industry.
A gain in some ways, but definitely a loss to the front line.
Yes. And so how do we really look at how this is impacting women is we know that women healthcare workers experience higher levels and higher rates of burnout and are more likely to experience mental health conditions. And we know that healthcare, it's really, really causing high levels of burnout. The stress, the physical demand, the emotional demand, all of those things kind of fit into it. And so we're looking at how does the fallout of the COVID-19 pandemic impact women? That's a very harsh reality of something that we all need to come to terms with and very quickly find solutions for that. Realistically, we're also looking at issues with, not issues, but more progress being available and needed with diversity inclusion in leadership positions, right? So there's a really interesting study that came out that said men hold 75% of leadership roles in healthcare, whereas women hold 66% of the entry-level jobs. Right? And so now we need to really think about how are we supporting that leadership pipeline of getting women into those types of roles if we know that the vast majority of nursing is predominantly female. Then what are we doing to support that role into getting them into leadership positions, right? And it's happening. It is happening. Lots of organizations are talking about it and they're making progress. But it is still an ongoing thing, and it's going to be an evolutionary process. We all need to be committed to making these changes to make sure that we continue that progress. It's a long-term goal. Right. And hopefully we all see those things in our lifetime, but it is going to take time. And we don't have time. We have clinicians that are actively leaving the field, that are burnt out. They're exhausted. They're taking care of families. They're taking care of aging parents, whatever it may be. So we need to find a way to have more representation. And then the other part of it is looking at just women as a whole. We know that there are so many women that have the responsibility of being female clinicians, right? But also tend to go home and then have a lot of household duties. They're taking care of kids, taking care of partners, taking care of parents. And so we know that this is an additional amount of demand that is happening to the clinician. So it's not just the 36 hours or the 40 hours or even the additional hours that they're working. It is a huge part of their life to then balance that with so many other factors. And there's a report from McKinsey that came out that said that physician mothers, 55% of them considered changing their roles when they became moms.
Really?
55%.
Wow. Away from being a physician.
Yes, in order to accommodate the domestic tasks. So they listed 5 main domestic tasks that they felt took up a majority of their time: childcare plans, cooking, grocery shopping, and laundry being 4 of them, but then even just the overall struggle of trying to take care of themselves. And women in healthcare are twice as likely as men to cite parenthood and increased home responsibilities as reasons for missing out on some of those promotions, cutting back on a little bit of time for the career development in order to juggle all of those other things. Those are all very realistic challenges that women face, regardless of industry, but absolutely critical when it comes to healthcare.
Yeah. Wow. Yeah, though that's a good overview, and it's really complicated, and I think, as touched on at the beginning, all of those challenges touch on each other, don't they? Like there's a lot of different linkages between all of the different challenges, and it gets really complicated as you add roles, and I think often as you climb the ladder in terms of leadership as well, it can get more complicated as well.
Absolutely.
So I'm looking forward to talking about at the end on the, you were talking about the leadership, how we can support women in leadership. There's some things that employers can really think about and do to focus on that, as you say, over a long-term structural process. Okay, great. Thanks so much for sharing that. So we also wanted to chat about what's really important, some simple things that we can all do in our daily work to support our women coworkers and employees. And I know when Rachel suggested bringing Ryan in on the chat, she touted Ryan as someone who's really doing a great job of this in her role, supporting her team, and has some really great ideas and processes for supporting the women coworkers and employees. So Ryan, are you planning to take on this conversation now?
Yes, absolutely.
Awesome.
Ready to go.
Okay, great. Let's go. So what are some ideas?
So I wanted to start. I came across a very interesting fact recently from Project Hope about the role that women play in the healthcare force. And women make up 70% of the healthcare force and 90% of nurses and midwives worldwide. And it's estimated that 5 billion people rely on women healthcare workers for essential healthcare services. 5 billion. So nurses are extraordinarily important, and recruiters and people who help find nurses positions also have a really important job in helping the nurses to help the patients, which is we all have the same goal there. So I have a few different things I wanted to discuss. First part is from the recruiter perspective, communication and the importance of developing personalized and consistent communication with every clinician we work with and establishing trust. And I spoke to a lot of clinicians over the past month and asked them about their experiences in finding new roles in healthcare. And the number one thing that they want from a recruiter is great communication. That being said, there's a fine line between great consistent communication and bombardment. So it's important to be a little bit careful there. But what's the difference between somebody just, getting the phone call and getting the text message to submit their documentation and having a recruiter who reaches out and cares about what's going on in their lives from a professional and personal level? So I think that those are two aspects that are super important to touch on from the professional level of understanding where the clinician is now and versus where they want to be and how we can help with that. There are so many nurses who have changed their whole path since the pandemic, as Rachel said. I mean, it completely changed the game. So we speak to people who are getting into the field of travel nursing for the first time, who have been in it for a while, and maybe want to climb the ladder or get involved in different specialties and kind of learning from the professional standpoint of understanding their goals to see what we can do with keeping eyes open for upcoming opportunities or training sessions, things like that. And from a personal standpoint of just getting to know the nurse. We're all people. And these nurses work so hard every day. And to ask them a little bit about themselves and their family and what they like to do and setting reminders. This is just a little tip, but setting reminders in calendar for follow-ups and check-ins, whether or not you have the information that you promised. If you said, I'm going to get back to you on Wednesday about a particular deadline and we hadn't heard back from the facility, reach out and say, haven't heard back from the facility, just wanted to check in. But it's important for the clinician to understand how hard you're working for them.
Right. That's great. And I think, like you said at the beginning too, it's like anything else, but in particular in this relationship, people need updates. They need to know what's happening without being bombarded. But if you let some of those slip by, they can easily think you've forgotten about them, or they will forget about you and move on too, right? Or feel a little bit abandoned, depending on the relationship. So that's great. Good idea. Thank you.
Exactly. And that brings me to the second part of not shying away from the hard conversations. So as a recruiter, there's only so much in our control. And one of the things that is in our control is the rapport and relationship that we're building with the clinician. And there's a lot of setbacks that arise. Orientation dates push back, things not submitted in time, whatever it might be. It is so important for the recruiter to stay consistent in communicating with the clinician because they want to hear what's going on. If the timeline is a little off, that's fine, but give the update. And that's definitely something I learned when I first started recruiting. And if I hadn't heard back from the hospital, or if it, wasn't the answer the clinician wanted to hear, and it's like you get these phone calls all the time of, I need the update, what's the deal? But I learned very quickly that if I just take the initiative to say, listen, we're sorry, this is what was supposed to happen. We're not there, but we're working on it. That goes a really, really long way. And I was speaking, it's so important because it's easy to try to put off those conversations when things aren't going exactly according to plan. And I was speaking to a clinician yesterday who is wonderful, and she's so happy at her job now, but there were a few bumps in the road and she had a delayed start date. And she said that one of the reasons why she felt confident in us in direct shifts is she knew we were working hard and we weren't letting things fall in the cracks. So when, the answer wasn't what she wanted to hear, she had faith in us that we were going to do what it takes to get her to work as we promised. And there's the loyalty there and the sense of trust that comes with that. And I think it is super, super important to emphasize the need of consistent communication and updates for the positive and the negative. And maybe you don't have the answer that day. That's fine. Share it.
Right. Great. Okay. Yeah, sounds good. Important to talk about the hard stuff, not just the easy conversations.
Yes, being comfortable with the discomfort.
Right on. Well said. Great.
Thank you. So third thing. So the first 2 points were about communication. All of these are about communication, different levels. But as a recruiter, it's our goal to get a clinician into work, but it shouldn't stop there. So first of all, in preparation, we need to ensure that clinicians are fully prepared and supported for the role. And yes, that means getting documentation in on time and all, setting up and handling all of the logistics. But it also is setting realistic expectations and following up, letting them know that we're supporting them through this process, letting them know if they're getting into a facility that has certain demands or difficulty, and putting them in a position where they feel prepared walking in on their first day. So something that is very common when I speak with all nurses right now is the divide between travel nurses and staff nurses.
Right.
And I really wanted to touch on that because it's so important. It's new because travel nursing has exploded.
Right.
And it makes sense, if you have people who have been working at the same facility for decades and someone's coming in with a short-term, 8-week or 13-week contract and they have differences in pay, it's frustrating from the staff nurse perspective of they're coming into your territory, and making a different paycheck. And I've spoken to nurses who have had very, very different situations, and some where they'll go in and staff nurses will hide the equipment and things like that. And then you'll talk to people, and the difference between speaking to a travel nurse who goes in and says, wow, the staff nurse was there with open arms. And I spoke with a few staff nurses and travel nurses and just asked some questions about their experience in this. And one of the things that I heard from staff nurses is that travel nurses will come in and there's like kind of this preconceived notion that they're going to be a little bit lazy. It's not their territory. They're walking in. They don't know it. They don't know the gist and how everything is operating. And for that reason, I think it is first impressions are everything, right? And it is so important for a travel nurse to walk in on that first day and make it clear that they are there to work and they are there to work hard and just as hard as the staff nurses are working, because at the end of the day, we should be blurring the divide. They all have the same goal, patient care, right? And that's the objective.
And we're all carrying the workload too, right? Regardless of our specific situation, we're sharing the workload on that unit.
Exactly.
Yeah, absolutely.
Right? Exactly. So having that mindset of going in and saying, this might be my first day, but I am going to be working just as hard as you and do absolutely everything I can to make, to help with your day to day is very important from just in terms of first impressions of kind of setting the stage for the type of relationship that you want to have with your coworkers, working in a hospital. And from the staff perspective, it's going in with open eyes. These people are coming in to take a load off the staff nurses because they need the help. And I think it's important for staff nurses to keep that in mind of everyone has the same objective. And it's up to the travel nurses to put in, the extra effort when they get there of setting the expectation that they're there to work just as hard as everyone else.
So what has worked? What have you seen working in order to bridge that divide and bring people together? What have you tried?
So we've spoken to there's a few facilities that from the get-go, clinicians walked in and said, when we called up to say, how has your experience been over the past 2 weeks? One of the first things a nurse said to me recently was, I can't believe how well I'm treated from the staff nurses. So I think, first of all, there's in a lot of facilities, the message is there of, welcome with open arms. But things that we can do is, as I said, first impressions are everything. Going in from the get-go and saying that we're here to work hard. And I spoke to a travel nurse who said, I walked in there the first day and people looked at me like I was, the worst. I was coming in there into their territory and I quickly proved myself. I asked questions. I offered to help. And she said it was so, so important to make it clear to everyone that I want to be there to do the hard work. And I think from both sides, the effort going into kind of softening that divide and understanding that patient care is on the line and that that's the main objective of everyone there is so important to get blurring those lines between travel and staff
nurse. So that it sounds like, I mean, it's all about communication again. You've talked a lot about communication. There's roles every individual plays, and then there's obviously a lot of background and preparation work that the organizations on both sides can do to make sure things go smoothly at the beginning. That's what I'm hearing.
Yes, absolutely. And respect. Everyone is different. There's people coming from different walks of life with different temperaments. No two people are the same, but to have that common ground of respect and try to listen and hear each other out. At the end of the day, all nurses are there for the good of the patients, and this is what they're signing up for. It's not for personal gain. It's not for anything other than patient care. So that respect is essential to everything they do, and ultimately getting rid of that divide.
For sure. Okay, that's great. Thank you. And coming back to our initial conversation at the beginning about the different roles women play, you talked to me when we spoke last week about what you do when you're managing a team with other female recruiters. I think you have a mainly female team, or maybe 100% female team, I'm not sure. And what you do to offer support. You've touched on this a bit, but do you have anything more to add about that?
Yes. So there's men and women in my team.
Okay.
But I think in terms of support, could be the same across the board. In my case, of maintaining the back end support, and that again, so much of this comes down to communication, right? That's what we do as recruiters in healthcare, and checking in, making sure that every person on your team feels that they are being heard, they're being supported, and as my boss always says, that they are in a position where they can be the most successful. And what we can do to put them in a position to be successful, because we all have the same goal. We all want to help these clinicians go into work. So I think personal check-ins, one-on-ones are very important for that. And I also think because all of this is so new and it's just a booming industry, everyone can have an impact. So reaching out and saying, we've been doing X, Y, and Z. How is this working for you? How is it not? And what are your ideas? There's so much to gain from everyone on the team, and no matter what the position or level is. And I think that it is super important for everyone to feel that they are being heard and listened to, and that they can impact our day-to-day functioning as an organization.
Right. Okay, that's great. Thank you. Yeah, lots of good ideas, lots of tips from your day-to-day experience. Anything else you wanted to add before we move on to sort of the more structural policy things?
Just a little tip.
Okay.
In our world of online meetings, I think cameras on is very, very important, and not always the easiest. Sometimes people aren't in positions where they could just have their camera on, but we're missing that human aspect, right? We're missing that personal connection, and figuring out a way to build that. One of the things is the visual contact there, of being able to see how someone's responding, reacting. And I think that trying to enforce more visibility throughout the week is a very important tidbit as well.
And that's a good one, since we've had so much more remote work happening, maybe not so much on some of the front lines of healthcare, but definitely it's affected all elements and different roles. So that's a good tip for sure. Great. Okay, great. Well, thanks for sharing all of that. That's really helpful. And feel free to pitch in if you think of something more, because I know you have lots of great ideas. And I think Rachel's going to take our next topic area, which is thinking about how employers can implement more higher level structural changes, policy changes, in order to make sure that women are supported throughout the organization, rather than just at the frontline personal levels. Rachel, what are your thoughts about this topic area?
Yeah, this is the most exciting part of all the topics that I've covered so far. I think we take for granted, it's so easy for us to take for granted how much we presume women are all the same. And I think that when we think about women in the workplace, we tend to think about earlier stages in career, right? Maybe when they're getting into the part of potential parenthood, motherhood, right? Juggling all of those things. But the reality is that women, yes, make up 50% of the population, but there's so much diversity in terms of what resources are needed, what supports are there and available, what do you dream about, what do you fear, what are your goals? We can be at totally different stages in our lives, and we need to make sure that from an organizational perspective, those changes in those support systems are really timely and relevant for such a wide variety of where women can be, and not just presuming that they're in one phase of life and that's the most predominant. So, for example, lots of organizations right now are looking to offer more benefits packages and resources, right? And that comes with maternity leave and IVF. All of those things, incredible, because it allows women the opportunity to be flexible and have both of those things, right? Because we know that going back to one of those main challenges is balancing those factors. But the reality is that there's only a small group of your workforce that is going to find that timely and relevant.
Sure.
Right. And so as great as that is in progress, we also need to think about, what about the women that already had their kids?
Right.
Right. What about the women that chose that wasn't the right path for them? All of that is okay. And so I think we need to really be able to understand that we're in such a unique position in making these decisions and having these conversations to champion and support women in all their choices and all of their goals. Right. And part of that comes through a couple of different ways. Really developing structure that supports open communication lines directly with the clinicians we have. That's a huge part of at least my responsibility at Direct Shifts. We need to make sure that we maintain open feedback loops, and that comes through such a wide variety of different types of touch points. That can be phone calls, open office hours for clinicians to drop in, town halls where we give our clinicians open access to having a seat at the table and tell us what we're doing right. Where do we need to improve? Making sure that they feel that it's an open forum, interviews, surveys, you name it. It's so important to have organizations build in communication lines and feedback loops directly into their infrastructure. And what this is going to do is it does two things. One, it reinforces that personal relationship that the recruiters have worked so hard to build, right? They already have that relationship and the interpersonal connections that they've really worked hard to foster. So now we need to continue that. Right. And then the second part of what that does is it actually gives you quantitative and qualitative data for you to then make decisions off of.
True.
And those two things, you cannot replace those two parts of what you get by making sure that your infrastructure supports open communication all of the time, and taking that data in, adjusting from it. You need to hold yourselves accountable to making adaptations as the feedback comes in, right? And part of that is because what women need, the diversity changes, right? It could be more financial management. There are so many women that are college educated. Most women hold student debt. So when we're talking about student loan forgiveness and paying it back and making sure that women are financially supported, we know that that is a very, very likely resource that our clinicians are going to need. And so we take that feedback, we take that data, and then we make those adjustments and really asking personal questions, because we know all women are not the same. And we really want to make sure that we're a little bit of everything for everyone. And it's tough. That's not always the best advice for an organization, but we are in the human business. That's the reality. We are always working with human beings that have their own drives and desires.
All about relationships.
Communication is at the forefront of everything. And from the organizational side, we need to implement structure that supports that to be continuous.
And you touched on something. It's more than just, it's important to recognize all the different roles women play in work and in life, but it's beyond that. It's the different stages of their work and their life as well, right? Their career. So that's really interesting to think about it from that perspective as well.
Yeah. And part of that, going off of that, think about what you're implementing from a longevity perspective.
Right.
So
Retention.
let's take Ryan and I, for example, right? We work with direct shifts. We get a ton of support. We're incredibly lucky to work for the organization that we do. We're in a very similar point of time in our lives, right? Similar ages. We can be within a few years into this role, right? We may have very specific goals and dreams of what we're hoping to obtain. In 5 years, it's entirely possible that Ryan and I's lives and our goals could look entirely different,
Right.
even from each other, not just from where we're at. And that's okay. The things that we may need, we could have families, we may not, we may have different goals, we may have different definitions of how we quantify work-life balance. And that's okay. But the hope is if you're focused on benefits that aim to retention, then that means you have to be adaptable to your female employees, your team members, your clinicians, to be able to have that room to make different choices from each other. It's not a pipeline from one step to the next step to the next step. So ultimately, any organization that has, Ryan and I together, 5 years could look different. 10 years could look even more different. And so we will still need to be supported in an adaptable way. And that's what we're really aiming to do with direct shifts for the things that we offer to our community, is being able to say, you're allowed to really make any choice. And we're here to support whatever it is without judgment and without preconceived notions of what we think you're going to want.
Great tip. Thank you.
Just to tag on to that. So I think there's two aspects. The first is listening. And as we speak to these clinicians, of saying, here's where you are now, where do you want to be? And how kind of can we, during your assignment and after, help you to achieve those goals? So I know Rachel's been working on creating different training programs and things like that. That's fantastic. We want to help our clinicians get to where they want to go. And maybe that means connecting multiple clinicians within our network who, have different experiences and want to learn from one another. I also think that that's an important thing, but we want, as you said, retention. And the best way, to have employee and, clinician retention is a feeling of
growth and opportunities, and they know they're supported, and they know that there are opportunities within the organization.
Absolutely.
Right? And another thing in terms of communication, and someone shared this recently with me, in terms of retention, it's seen often that people in healthcare don't always know what benefits they have available to them within their own organization. And it might be because they're transitioning from different roles or stages of their life, depending on children, education, that kind of thing. And suddenly they see an ad for the competitor down the street who says, hey, let us help you with your tuition. And suddenly they're looking at making a move to the organization down the street without their own employer advertising to them the benefits that they already had access to. So communicating the benefits and the great reasons to be in your organization is obviously really, really critical as well.
Yeah. And honestly, at the end of the day, one of the biggest points that I cannot emphasize enough is finding a way to be human-centered, but still data-driven, right? How do you have both when you're enacting structural policy changes or organizational changes that apply to a lot of people, right? We want to be data-driven. We want to make sure that we understand what is needed, what is necessary, and getting that feedback from clinicians. That is data. And it's even asking those personal questions, both from the onboarding process or the recruitment process of Ryan trying to figure out what is the clinician's goals, but then also maintaining those feedback loops of going, okay, we're taking in all of this data, but also being human-centered in how we approach it. Yes, we want to make sure that everything we do is well-informed, coming directly from the clinicians. We want the clinicians to tell us what they need, what they want, what they're looking for. But that human side of, it's so easy for us in positions to speculate and hypothesize what we think one is going to want, right? How do we take out that speculation and actually replace it with empathy? How can we actually put ourselves in someone else's shoes, in shoes we will never walk in, we may not ever fully understand, but it is our responsibility to make sure that we're putting ourselves in that situation with that kind of empathetic framework of going, okay, maybe I'm not an RN who has a child at home. I'm not rushing home to put dinner on the table. I'm not then trying to get kids off to school in the morning before my shift starts. We may not ever experience that, right? But it is so important for us from that perspective to really think about what makes an impact and using clinician data to drive that. So I'll give you an example. 40% of women are at risk for insomnia. And we know that shift work, crazy, right?
Yeah.
Shift work is a huge proponent for driving sleep disorders. Women need sleep. We have RNs and nurses that are working around the clock on shift work, and they're 40% more likely to have a sleep disorder. That's data. We know that. From an empathetic perspective, we all need sleep. We all know what that is like, right? We can't just presume that they need sleep and we don't. We know that from an empathetic standpoint. So then we now need to figure out, do we need to implement more sleep resources and benefits packages that support that, provide more resources and knowledge around those types of support systems to make sure that our female clinicians that are in a pipeline towards sleep disorders, more likely because of the type of work they're doing. Okay, how do we then blend being human-centered and data-driven in order to make this be an appropriate step for us to offer? And that's just one example, but that's what organizations are really going to be called on, of how to manage those two factors and be quick and adaptable to the resources that are needed right now.
That's a really good concrete example. If you say 40% of women are more at risk for insomnia, and we know that 90% of nurses and midwives around the world are women, as Ryan shared earlier, then you have a huge challenge within your workforce if insomnia is affecting 40% of that part of your workforce. So that's a really good concrete example. I have a question. So when you find a structural change that's needed like that, when you identify a problem, you're hearing from multiple of your coworkers or your employees that this is a gap in your workplace, how do you take that forward to management? How do you take that forward and start recommending and lobbying for some improvements? That can be challenging sometimes, depending on the organization.
It is challenging. And overall, we're actually very lucky to work with a structure that Direct Shifts has, where it doesn't matter what team you're on, what position you're in. We all have our own professional background and experience and things that we're seeing day to day. And we have an open floor to be able to really discuss what are some of the issues, as well as creating a culture of, if you see a problem, it's on you to push it forward.
Absolutely.
And having that accountability is really something that our organization gets very well, right? Because we are all accountable for our roles being as good as we can possibly make them. The sky is the limit, right? And part of that is then going, okay, I'm seeing an issue, a gap here and here, right? These are some of the solutions that I think about. How do you gain buy-in with other key stakeholders? And stakeholders can be everyone. That can be the clinicians, that can be people on other teams, right? And part of that is when you're making decisions that are based on that data and the feedback of what you're getting, you want to make sure that in a lot of ways it's secured, it's supported, and it's irrefutable, right? And really taking it to the right people at the right time to have those conversations of going, even, and again, having those difficult conversations. I've isolated an issue. I may not know exactly how to fix it. These are some ideas, but I really need the additional support, right? And from your organization, I think one of the biggest steps is being pushy, right? Making sure that you know that what you're fighting for, at the end of the day, we are so clinician focused that when we're trying to solve clinician problems or issues that we're seeing in healthcare as a whole, the accountability is on each of us to play that role in finding a solution that supports them. And putting the right key people together, that's going to be the toughest part, but that's where you really are able to champion solutions.
Yeah, being assertive and sharing the problems or the challenges you're identifying and coming with the data that you talked about, whether it's the anecdotal data can help, but the more scientific data that you're collecting over time, and also identifying the problems this is going to cause if we don't solve this sooner rather than later, right? And so I think those are good suggestions in terms of how to take that forward. And you are lucky, as am I, that we work in organizations that we don't have a challenge with that. But that's great. That's really good advice. Well, thanks so much for all of your tips and ideas and your the data you brought to this and the examples. It's really helpful. Is there anything else you want to touch on before we wrap up today about the challenges women face and how we can support that? And if not, it's okay. I just wanted to make sure you had the opportunity.
So I'm just looking, and I saw a question in the chat about about not crossing the line between building a personal relationship and getting too personal. So right. Just to touch on that, we're not therapists. We're not here to sit there and say, tell me your deepest, darkest secrets, but we are here to say, what's your day-to-day? Do you have kids? What'd you do last weekend? You know, like what are you interested in? And it's like the little tidbits here and there. I think the most important thing though is the family aspect of if you're dealing with someone who's, you know, kind of younger and living on their own, or older with 4 kids at home and has to deal with that. That's going to change how you approach that clinician, right? And the assignments that are offered and different ways that we can help. So I think it's the little facts here and there. It's the checking is how to build the relationship. And I think it's also checking in after the assignment starts of saying, how are things going? And just that continued communication. But the little facts here and there about day-to-day life and personal preferences is how to get to know someone better. And you take it from there.
It's really about the relationships. Again, having a human approach, as you both have talked about, and making sure you're following up on that and coming at it with intention and meaning, right?
Exactly.
Right. Okay, well, that's great. Well, I'm going to put on the screen your LinkedIn contact again so people can find both you, Rachel, and Ryan there. And I do want to share a comment from Vamshi, who I think is one of your senior managers. He says, 2 of the best at direct shifts with real knowledge and experience in healthcare workforce and how best to enable clinicians more. Super proud to be working with Ryan and Rachel. So thanks, Vamshi, for that comment. And thanks, Rachel and Ryan, for bringing that great experience to our webinar today. We really appreciate that. And I'm also going to, again, put my link in the chat to my online business card, and it's there on the screen again as well. Again, you can connect with me. You can find out about all of our free resources there at ApplyChat Healthcare, mainly regarding nurse recruitment. And after this call, I'm going to jump into my Zoom room. If there is anyone that wanted to speak with me about what we do at ApplyChat, please connect with me over there. I'm going to put that in the chat now, and I'll connect in there after the call. So Rachel, Ryan, thanks so much for everything today. We really appreciate this. And
thank you.
Yeah, this is fantastic.
Yeah, thanks for joining. That was lots of fun. And thanks for all the work. I know you put a lot of work into preparing your thoughts. And I do appreciate you also reaching out to your colleagues too in the last week or two to get their input. You had told me that this generated some really interesting conversations among your colleagues. So that's great. Well, thanks so much again. Yeah, great. Thanks so much again, and thanks to our audience. And we will have another webinar in 2 or 3 weeks. We'll be posting that, so please do connect with us. And you can find my link to find out about that next webinar. And we look forward to seeing you then. Thanks both. Thanks, everyone.
Thank you. Thanks for the opportunity.
Bye-bye.